I'm thrilled to welcome a special guest to our first episode. For over a decade, we've been colleagues, we've been neighbors, and we've been good friends. And as a board-certified dermatology nurse practitioner, she's undoubtedly made a huge impact in the lives of her patients as well as mine. I'm excited to welcome Autumn to our very first podcast, very first episode of season 1. So welcome.
Thank you.
You're welcome.
Yay.
So today we're going to talk about a topic that is so incredibly common in the office. We're going to talk about acne. Just a few statistics. So acne affects 85% of the global population. So acne is definitely, a problem that is so incredibly prevalent.
Mm-hmm.
The cost of acne in the United States exceeds $1 billion annually.
Crazy.
I know, right? Studies also show that greater than 60% of acne patients suffer from low self-esteem, depression, and anxiety. So it doesn't just have a physical effect, it has a mental effect as well.
Yeah.
So just kind of jumping right into acne, Autumn, talk to me a little bit about when acne is starting in the skin, what's actually happening under the surface?
So there are a couple different things that are going on. One, there is typically excess sebum or oil production under the skin. That can kind of trap dead skin cells. Naturally, your skin will cycle through. Dead skin cells will slough off, for lack of better words. But when you have that excess oil production, it can trap those dead skin cells, which creates inflammation. Bacteria will come, bacteria can grow, and then it just creates those little inflammatory acne bumps. So it's a cycle.
Yeah.
But
for sure. So that increase in oil production, that seems to be at such the root of acne.
Yep.
When we're looking at acne, we typically will grade it.
Mm-hmm.
So when we're assessing our patients right out of the gate, the first thing we're looking at is what kind of acne bumps are we dealing with here? Are we looking at the beginning acne, what I call sort of like beginner's acne, or are we looking at an acne that is a more progressive disease state?
Yeah.
So let's kind of talk about a little bit when we're grading acne, what does that actually mean? What are we looking at?
So I break it up into two different categories, mainly. So you have non-inflammatory acne, blackheads, whiteheads, the little bumps or textured bumps that sit under the skin, or blackheads.
Mm-hmm.
And then you have inflammatory acne bumps. So the big pink, red, painful pimples, what people think of when they think of a pimple.
Yeah.
Or like nodulocystic acne, bigger, painful, deeper cysts. So I'll start by dividing into which category out of the two.
Comedonal versus non-comedonal.
Yep. And then that will direct my treatment regimen.
Yeah. So, I love to talk to my patients too about when we're talking about whiteheads, because whiteheads, I think there is such a misconception with what a whitehead actually is. I think most people, when they think about a whitehead, they think about the pimple that comes to a head that they can pop.
Yep.
And in reality, whiteheads, that's not actually what they are. So whiteheads, basically when that oil gets trapped underneath the surface of the skin, that inflammatory reaction hasn't really started yet, and you see that sort of textured skin-colored bump under the surface. Yeah. Those are actually very much grouped with blackheads. So treating that type of non-comedonal or that type of comedonal acne, whiteheads and blackheads really fall into that same group. And I think that's important to make note of because so many patients, I think, they think whitehead, pop it. And those are actually pustules, which is more inflammatory. That's right.
Yep. Different treatment.
Absolutely. So when we're staging acne, when we're grading it, that really affects the treatment approach. Let's talk a little bit about when we're treating this comedonal acne. For myself, I typically like to start with very mild products when we're talking about younger patients. Comedonal acne, we tend to see that in more young patients or in patients that are using products that are pore clogging. Right. What is your typical go-to?
So it depends on the severity, the age, and honestly what I think their skin will tolerate. Usually I'll start with like a salicylic acid cleanser. Some of the leave-on products I'll reserve for different options. So a good salicylic acid cleanser, work it on the skin, let it sit for a minute, wash it off, and that will help to increase skin cell turnover, release some of that buildup. So cleanser wise, I love that. Or I'll do a gentle cleanser and maybe start them on something like Differin gel.
I love
I
different.
love Differin. And a lot of people think, I even had this conversation this morning.
Yeah.
A lot of people think that just because it's over the counter, so there are two strengths. I know you know this.
Yep.
There's the 0.1%, which is over the counter, used to be a prescription. And then there is still 0.3%, which is a prescription. But the 0.1% is still so effective.
I love different. In fact,
I
it's
love
my
it.
go-to.
Yes.
Pretty much for every patient that
Yeah.
I see when we're starting a over-the-counter topical retinoid.
Yep.
So tolerable,
Yep.
and it's effective, more
So
importantly.
effective.
I know.
Yeah. I love it.
Yep. So salicylic acid, comparing salicylic acid with topical retinoids.
Mm-hmm.
Tell me how you advise your patients when they're over the counter at the pharmacy looking for products on the shelf. How do you direct your patients as to which they need to go for?
So again, it depends. If they seem to have more sensitive skin, then I'll start slow. And I always tell them we want this to be, it's a slow process. We don't want it to be like a chemical peel. And if you're using too many things at once, it will feel like a chemical peel. Your skin's going to get irritated and you're not going to want to use anything. So typically, again, I'll have them start with the cleanser.
Yeah.
And if we're doing the Differin as well, I may have them use the salicylic acid cleanser like on the weekends or 2 days a week or something. Just keep it simple. On those other days, just use a regular, gentle, like the Cetaphil gel cleanser. I love that cleanser. And then start slow. So I'll always tell them, even if it's over the counter, it can still be irritating.
For sure.
So start every other day for a couple of weeks. That gives your skin time to get used to the products. And then at that point, you should be able to increase to nightly. And then give it a good 3 months. I never want you to use it. You're not going to see an improvement in
And
it.
I almost would say even 3 to 6.
Very
3 to
true.
6 months.
So you have to give it time.
Yeah.
And I know I am in this position. And when I struggle with breakouts, I will also give it about 2 days and then I give up. So you have to power through. But as long as you give it adequate time, see what the products are going to do, you should see results.
Yeah.
At that point, if you're not, then that's when we're here.
I think one of my favorite things when we're treating patients with topical retinoids, I think one of my favorite things in such an educational moment to have in this moment when patients say, well, I stopped my topical retinoid because it made my face dry.
Yeah.
And it's like, we need to bump the brakes and we need to talk about some education for a minute because topical retinoids, they will. They absolutely.
That's what they do.
That's exactly what they do. In fact, that's what makes them effective.
Yeah.
You want to see that exfoliative effect that's happening.
Yeah.
Otherwise, it's not helping.
Right.
So to that point, I'll have patients that come in and when they're using a topical retinoid for, let's say, something like anti-aging, for example, which it's also great for that.
Love it.
Side note.
Yep.
I tell patients, the peeling is part of it. If you're using a topical retinoid and it's hydrating for your skin, throw it in the garbage.
Yeah.
It really is not helpful. And the same is true for patients with acne. If you're not having that exfoliative effect, you're not really helping yourself.
Yeah.
But I think the patience and the persistence with treatment is so key.
Yeah.
So when we're talking about this more inflammatory driven acne, so the more red, inflamed, the type that does the pimple, the typical pimple, and the nodular type acne.
Yeah.
What is your go-to? What is your plan at that point with your patients?
Over the counter or prescription?
Let's say over the counter first, and then we'll
Okay.
go to prescription.
Okay.
Yeah, so over the counter.
Over the counter, I love a benzoyl peroxide wash. I feel like that does
agree.
not get the credit it deserves. But again, you have to give it time. It's one of those things that you're not really going to use it one time and everything looks pristine.
Yeah.
So give it adequate time. But I love a BPO cleanser. A lot of the leave-on benzoyl peroxides can be irritating. Some of the newer prescriptions aren't as irritating. They've really tried to alter that molecule to prevent that skin irritation, which is so good. But I love the cleanser for that. And inflammatory chest acne, back acne, shoulders, the back knee.
I totally agree. I think
love it.
benzoyl peroxide so underrated over the
Seriously.
counter.
Yeah.
It is irritating, and it does
can be.
bleach. So as a mom,
Yes.
I'm like, hey, if we're using benzoyl peroxide, know that it's going to take the color out of clothes, sheets, towels. So it does bleach.
Use white towels.
Use white towels,
Keep
white
them white,
sheets.
yeah.
That's right.
You're welcome.
Right. But I think that benzoyl peroxide's not even just with the cleansers, but the topical gel, benzoyl peroxide gel.
Yeah.
I love that, especially for spot treatment.
Yep.
So,
too.
yep. Over the counter, any other thoughts?
I do like I like the hydrocolloid patches for inflammatory bumps, and a good little trick. I'm sure you know this, but they sell the pimple patches, which are marketed as such. They are a little bit pricey, but you can also buy the Band-Aids, just the regular Band-Aids. Cut it to size. It's still sticky. Same exact product and significantly cheaper. So I like those a lot.
Pimple patches are so great, especially for
my
patients
gosh.
that pick.
Yes.
I
Yeah.
mean, if you're likely to just go after a spot, it is such a great way to keep your fingers off of it. And it's actually helpful at helping to clear the bump. So, love that.
I know.
What about prescription?
Prescription-wise, again, a benzoyl peroxide, and typically, depending on allergies, of course, I like a clindamycin benzoyl peroxide.
Yes.
The two make each other work better together. And then you also have the benzoyl peroxide prevents that antibiotic resistance you can get with the clindamycin. So I love that. I love Cabtrio.
Yeah,
I'm
that's
really
sort of a new one.
about that
Let's
one.
talk about Cabtrio because that actually is one of my favorites too right now.
Same.
It's such a nice one-stop shop,
Yep.
especially for, young patients, teenagers that struggle with compliance. Yep.
Yes.
So benzoyl
huge.
peroxide,
adapalene, and
clindamycin. Yep, all in one.
Yep.
So love
Which
that.
sounds like it would be irritating, especially with the products that we're previously used to. It sounds like something that could be irritating to the skin, but they nailed it.
It's effective.
Yeah.
I mean, I have really seen it work, especially in patients that, at first glance, I might have a thought of, okay, we need a systemic treatment, but maybe, parents or whatever aren't on board. Yeah. And it's such a good starting point because they do see results. Might not fully clear the patient, but certainly going to see a positive response for sure.
On both types of acne.
Yeah.
So the clindamycin benzoyl peroxide for inflammatory acne and the adapalene for blackheads, whiteheads, skin texture.
Yeah.
Which
I love because most patients, especially young patients with acne, usually we're looking at that combination. You're looking at some blackheads, some whiteheads, some inflammatory bumps. So it really is a nice all-encompassing once a day, use it before bed, simple treatment that is effective. So yes, I agree. Cabtrio is a winner for me, for sure. What about systemic treatments? When do you feel like the time is right to start oral antibiotics or other systemic options?
So if it is inflammatory, if they have tried topicals and failed, or if it's pretty significant, then I will suggest a systemic treatment. One of my go-tos is a medicine called sarecycline. It's the only FDA-approved antibiotic for acne. So I love that. It doesn't cause sun sensitivity like things like doxycycline or some of the older tetracycline antibiotics would. You really don't get that stomach irritation. And this one, too, you usually see an improvement. I'm always cautious to say this, but you tend to see it a little bit quicker.
Yep. In fact, they market it, I believe, at like 2 weeks. You should see improvement.
Yeah, which I'm cautious with that because setting expectations is,
For sure.
Ugh.
Yeah.
But you do tend to see that anti-inflammatory effect pretty quick.
Yeah,
So
I totally agree.
I love Sacera. Accutane or isotretinoin if it's necessary. Certainly if we are seeing scarring acne, if they have tried and failed on a topical systemic regimen, antibiotics, or like I said, sometimes I'll go straight to that if there is scarring involved.
Accutane is such an interesting area of acne treatment because I think, at least clinically, what I see with patients, I have some patients that come in or parents that will come in with their teenager and they are in hot pursuit to want Accutane. They want it. They don't want to waste time on topicals or other antibiotics or whatever. And then it's almost like the polar opposite.
Absolutely.
You've got patients that come in and they're like, I don't even want to hear the word Accutane. You know what I mean?
Yeah.
So it's, usually, again, a good educational moment to sort of explore what the hesitations are with Accutane. So let's talk a little bit about what Accutane actually is. So Accutane, go ahead.
Vitamin A derivative.
Yeah.
It helps. I mean, basically, when you start it, it will essentially decrease or stop that oil production.
Yeah.
So one of the biggest side effects that we talk about with patients is dry skin, chapped lips.
For sure.
But it's everywhere
Yeah.
because it is a systemic treatment or something that cycles throughout the body.
Yeah.
You're not just going to have a dry face.
Yeah.
So dry cuticles, dry feet,
hair,
dry hair,
dry nose,
oh my goodness,
nosebleeds.
yes,
Then
nosebleeds, yeah, all the things.
yeah.
So like you mentioned, the side effect conversation is certainly necessary.
The biggest thing, the pregnancy. So Accutane,
Oh,
one
for
of the biggest
sure.
things with it is, it causes such severe birth defects if you get pregnant while you're taking it. So
absolutely cannot get
I
pregnant.
really think that's a large part of the concern around Accutane for a lot of patients. But then again, I think a lot of patients too, they look to social media. They go to TikTok and they hear, oh my gosh, TikTok.
Yes.
It's fun, but at the same time, when it
It's
comes
a
to
double-edged
skincare, I
sword.
know.
Yeah.
So I think they go to TikTok or other outlets to get their information about Accutane, and it really, it can seem very scary, I think, when you do hear, oh, it causes birth defects
Right.
or, all of these other potential dangerous side effects. Suicidal thought and behavior was associated with Accutane for a while,
Right.
which I think now pretty much has gone away. You don't really
Right.
see that listed.
Accutane
Yeah.
itself has been discontinued. Now
Oh,
we
well,
have
true.
the newer drugs.
Yeah, generics.
With that one. Yeah.
But, I think that for the right patient,
Oh my gosh.
it's great.
Yeah.
I took it.
I took it.
I know.
Yeah.
So, I know for both of us, I
Yeah.
think it was,
Life changing.
it really was. And I know for myself, scarring, while my acne was never bad,
Mm-hmm.
it was kind of persistent.
Yeah.
And, different things that I would try for it. And I was in the medical field at this point and knew what I needed to use. And it just, I couldn't get it completely clear.
Yeah.
And man, Accutane took care of it for me. So it's not
Totally
for everyone.
agree. Right.
Definitely
right.
not for everyone, but it is
Definitely involves a conversation with
for
your
sure.
provider. Yeah.
Oh, totally agree. So I think it has to for sure be like a group approach. It has to
Oh,
be
yeah.
right for the patient, right for the parents if it's a minor, but
Right.
definitely has a good place for
Yep.
me, I think.
Oh, yeah.
Yeah.
I love it.
So in terms of the causes of acne, so when patients come into the office and they'll say, well, what is causing my acne?
Mm-hmm.
That's a really tricky question because
is.
that question comes from teenagers
Yep.
and it comes from adults.
Yeah.
So when you're talking about a diagnosis that applies to such a wide age
Yeah.
range,
Right.
how do you go about answering that for your patients?
So it depends on the patient and what they're doing. If it's, say, a high school boy who plays football all
Yeah.
day and wears a chin strap and his acne is right here, he's growing hair,
Yeah,
beard
dirt,
hair,
sweat.
dirt. Oh, gosh.
Yeah.
Yes, practice outside, all the things. Then that will direct my treatment depending on, and the conversation.
Yeah.
Like when you're done exercising or workouts or whatever, practice, take everything off. I love hypochlorous acid.
Yeah.
I don't know if you
I actually don't utilize that very often.
Oh my
So honestly,
gosh.
I forget about it, but it really is great.
Love it.
Yes.
So I will tell athletes and adults, if
Yeah.
you go to the gym, I had somebody the other day that trains. So she can't take a shower after each training
Yeah.
session. She's there all day. So hypochlorous acid spray, it's anti-inflammatory, antibacterial, antifungal,
It's over the counter at the pharmacy.
over the counter.
Yep.
But that will help to clean surfaces, but you can also spritz it on you,
Yeah.
put it on your practice mat, put it on your yoga mat.
that's a good
I mean,
point.
I utilize it.
Disinfects the equipment too.
Yep.
Love that.
Yeah.
So let's talk about other causes of acne. So the sweat is an issue.
Mm-hmm.
Let's talk about one that comes up so frequently in the office.
Okay.
Hormones. Yes.
Yeah.
So obviously for teenagers, the hormones, that's a thing. And that's, I think, easy to say, oh, that's the cause of the acne and
Right.
people accept that and that's the end of it.
Yeah. You'll grow out of it.
You'll grow out of it.
Yeah.
So then fast forward ahead, especially for females, but
Yep.
now we see this also too with a lot of males with the whole like testosterone
True.
treatments. But
Yeah.
speak to that issue. So when we see an adult female, when we see these adult males that come in that are taking these testosterone supplements,
Mm-hmm.
talk about what's happening in regards to acne for these patients.
Okay. So, I mean, hormone treatments just in general with postmenopausal women with progesterone or hormone replacement. I mean, we'll also see more acne with that. So, again, it depends on the cause.
Yeah.
For a male taking testosterone, a benzoyl peroxide cleanser. But if you have to utilize that testosterone, I mean, maybe a topical option, but really,
That is a hard,
Yeah.
hard conversation because
I know.
now there are so many places where men in particular are going. But I mean, I see this too with women that
Yeah.
take hormone replacement with testosterone.
Mm-hmm.
So many patients that are looking at using hormone replacement, especially, aging population.
Yeah.
And, while it can be very effective and
Mhm.
help with a lot of different things that maybe they're struggling with that have ultimately led them to taking the
Right.
hormones, the acne, man, it is a problem.
Yeah.
And, I think one thing when I'm talking to my patients about testosterone in particular, because that comes up a lot,
Yeah.
is, it's not necessarily an indicator of having too much testosterone in your body or by taking too high of a dose.
Mhm.
What I tend to see as the issue with testosterone is it's just a side effect. I
Mhm.
mean, if you're taking a fraction of a milligram,
Yeah.
you can still have acne as a side effect to that.
Yeah.
So that's a really tough one because obviously testosterone makes patients feel better.
Yeah.
They want it.
And it may be necessary
and
in
it
some
may
cases.
be
Most
necessary.
cases.
Yeah. But, it's one of those conversations sometimes where it's like, we can try these topicals. We can try these other potential systemic options. But at the end of the day, so long as the testosterone is still on board, it still may be an issue. So that's usually a tough conversation.
It is.
But yes, testosterone for sure. That's something that I discuss a lot with, like I said, men and women.
Mm-hmm. Yeah.
Um,
With females, spironolactone
love. That is
can
my
be,
number one.
oh my gosh,
Love
can be
spironolactone.
so beneficial.
Yes.
So I absolutely love it. And that's another indicator or something that we look at as
Yeah.
providers, like teenage acne, very different, adult acne, different, hormonal acne. I mean, it has such its own distribution.
For sure.
So we see it jaw, chin line acne, cystic, painful,
Yeah.
scarring, and spironolactone, if tolerated, can be life-changing.
I love spironolactone. It's not for every patient, but for
Right.
sure, especially for these females that come in with that very classic
Yep.
chin, jawline, neck,
Yeah.
chest, upper back even.
Yeah.
Spironolactone, it's so effective. It blocks that testosterone surge that happens just naturally in the body,
Mm-hmm.
which when that testosterone level goes up, we know that it tells the oil gland, make more oil,
Right.
and that increase in oil production results in the acne.
Yeah.
And spironolactone works right at the beginning of that chain. So as that testosterone goes up,
Mm-hmm.
it blocks it. It doesn't allow that chain of events to happen.
Right.
It is definitely for me a number one go-to.
Oh,
And
I
I
love it.
especially love a non-hormonal approach, especially for females that are coming in.
Yeah.
Because for a long time it seemed like, oh, you have this hormonal distribution of acne,
Right.
let's just go on birth control.
Yeah.
And while birth control is,
Can be great, yeah.
still effective, we still prescribe a lot of it.
Mm-hmm.
It's not for everyone either.
Right.
And, it's nice to have an option that we can go to. In fact, I usually choose spironolactone over birth control for most of my female patients. I love it.
Yeah, I do too.
Very few side effects. I mean, it is a diuretic, so, I mean, it can help with water retention and other issues that patients may face, but low blood pressure.
Yeah.
I talk to patients about that one because it
Yeah.
can definitely cause some low blood pressure,
Yeah.
high levels of potassium, so we talk about those side effects,
Right.
but outside of that, pretty benign drug
Yeah,
and
it's
extremely effective.
I love it.
I will say this, though, about spironolactone, and I have seen this to be true for myself, even taking spironolactone.
Yeah.
It takes a full 12 weeks.
Before you notice
Yes.
an improvement.
So it is one of those things that I tell my female patients,
Yeah.
give it some time because you'll get there. It'll work.
Right.
But give it 12 weeks.
Yes.
And I mean like clockwork. I'll have patients call the
Yeah.
office at
Yeah.
like week 10 and they'll say, I'm still breaking out.
Right.
Like, what can we do? And it's like, nope, just give it 2 more weeks. I promise.
Stay the course.
And like clockwork.
Yeah.
2 weeks later, they follow up for that 3-month appointment.
Yeah.
And they're like, wow, that actually really,
great.
made
Yeah.
a difference.
Yep.
So when you're treating your patients, do you typically have a more conservative approach with your patients, or do you like to start aggressive? How do you like to approach your acne treatments with your patients?
So I like to make it very specific person to person, and I want them to feel involved as well. I don't like going somewhere where I have a problem with people telling me what to do. So I never want, shocker, never want anyone doing that to me. So I will give an option and I will tell them we can go a conservative route. Here's what we could do. We
Yeah.
could start topically or some people have had acne for years and it doesn't faze them. And so they
That's
just
true.
want a conservative treatment. Like, oh, use a cream, I guess.
Yeah.
It's fine. And then some people have had acne for 6 months and it is completely.
Where they have one nodule.
Oh my
Yeah,
gosh. Yeah.
it's
And
very
they're
subjective.
like, I want to do every single thing I can possibly
Yeah.
do. So it's really just patient to patient.
Yeah.
I make it specific and I try to I try to make them a part of the conversation
love
and
that.
the decision, and
Yeah.
just see what they will be consistent with too.
I think that's so important because if the patient is involved in the treatment plan, they are so much more likely to actually
Right.
execute the
Well, you
plan
feel
itself.
empowered. You feel like you're a
You
part
do.
of it. Like
Absolutely,
you
you do.
Yeah.
Yep. So I love that.
Yeah.
I will say sometimes with acne, I typically will have a little bit of a more aggressive approach, just because while there are some that do come in that are sort of, they're not really bothered by their acne. Most of them, that I see, they
came
are.
in.
Yeah. That's right. They're there, and obviously they're there because they're bothered. So, I like to sometimes, have a more aggressive approach with patients because I like to get results quickly.
Yeah.
So I like to be kind of aggressive, and then I start pulling back on treatment. So that, I think, for me has been a good approach with patients. But, to your point, if they're not on board with the treatment, aggressive or conservative,
Doesn't matter.
it doesn't matter. They're not going to do it, which brings me to compliance.
Yes.
Compliance and acne treatment it's a tough one too,
Yeah.
because, it's a marathon.
It very much so.
It's not a sprint.
Yeah.
You are in it for the long haul.
Yeah.
And it's so frustrating
Oh my gosh. Yeah.
because you're using these products every single day and you're not seeing immediate results. And it's so hard. It's like exercise. It's like trying
Oh
to,
my gosh.
you know what I mean?
Yeah.
So it's a
We
process.
want that instant gratification.
Totally.
Yeah.
Yes. So in moving forward with your patients that are non-compliant, how do you approach that?
So I try to find out what they would possibly be compliant with. So and I've had a lot of people who don't like the texture of things.
Yes.
So if they don't like the way a lotion feels, or there's a lot of aversions out there for people. So I also take that into consideration. They make, instead of like a topical clindamycin benzoyl peroxide together, I would possibly use a benzoyl peroxide wash.
Yeah.
And then have them use clindamycin wipes, because hopefully they're washing their face in the shower.
Yeah.
So
but if they're not, at least they have something they can
there's
go over.
Water,
Yeah.
it's in there.
Yeah.
So you're already taking a shower. That's easy. And then they get out, use a wipe, throw it away.
Yeah.
You're not having to take time, put something on,
Yeah.
So I try to find ways in different products that might be most beneficial for them.
I think one of my favorite mottos is, the best treatment is the treatment that the patient will do.
Yep.
You know what I mean?
Yeah.
It may not be the absolute best combination of things or the things that we would default to first for a treatment option. But quite frankly, if it's a treatment regimen that they aren't going to do, waste time. It wastes, the patient's time. It wastes money. Yeah. So I'm a big, big supporter of, if a patient comes back and they've not been compliant on their treatment, really getting to the root of what's the problem.
Exactly.
Is it a texture issue?
Yeah.
Is it just having to incorporate it into a routine issue?
Right.
Or is it just, you're dealing with, a teenage boy, for example, and they just don't care.
Right.
You know what I mean?
Right. Yeah.
So it's usually a conversation with the parent, which, the parent comes in and
they
they're,
have thought they've been
That's
using
right.
it for the last 3 months.
and that is, that's actually
it
a
happens
common
a lot.
conversation. Parents come back, they're so mad.
Yeah.
Kids still have acne. And then you get down to it and you're like, well, I'm looking at your skin. It's not dry. It's not red, full of acne. Like,
How many refills have you picked up?
Right? Oh, you're still on your original.
None.
Yeah. So,
Comes out.
always comes out. And then the parents are like, why have you not been doing your treatment?
Yeah.
But yes, common conversation to have for sure.
Yes, absolutely.
What are your thoughts on diet and acne?
So, gosh, I think we are still at the tip of the iceberg.
Yeah.
There's a lot, and rightfully so. I'm very excited about this huge emphasis on gut health, the microbiome, all the things.
Probiotics.
But I think we're just at the tip of it.
Yeah.
So, basically, I'll ask, do you drink gallons of skim milk, or do you drink a ton of skim milk?
Yeah.
That one seemed to be priority, or the highest cause of the inflammation there. High glycemic diet, just checking in. If you're eating a well-balanced diet, then, I say this just because I love Sour Patch Kids. One Sour Patch Kid a day.
Who's eating one?
I don't know.
Are you
I'm
eating just
trying-
one?
Maybe I have
One
great
box.
self-control. Yeah, one bag, family
One
size
bag.
bag. I am my girls, my dogs,
Right.
my family. So just it's. I don't think we have enough evidence and research on what exactly to recommend aside from just a nice balanced diet.
Yeah.
Now, things like whey protein,
Mm.
that has been proven to be a cause for breakouts. Biotin products
Mm-hmm.
also. So trying to see, I mean, we try to investigate,
Yeah.
when we're talking to patients. So trying to see if there's something that they're doing that could be contributing. But aside from that,
A big one, too, when it comes to food, I think, is interactions with the medications that we have them on. So, to your point, with dairy.
yeah.
So, if we have patients on doxycycline, for example, and they're consuming a ton of dairy, especially when they're taking their medication,
Right.
that can certainly interact with the medication, keep it from working.
Yeah.
So, I'm usually very diligent, too, with patients to talk about, okay, you're on this medication. These are the foods that you need to avoid or incorporate, for example. Probiotics. I love incorporating that, especially when we're on a medication like an antibiotic that they're going to be on for extended periods, which, brings me to another point, this extended period of antibiotic. That seems to be, an area, especially with parents, that they don't love.
Yeah.
And it's really very common in dermatology for us to prescribe antibiotics for extended durations. I don't love it, quite frankly. I don't really love having antibiotics on board for long periods of time, especially in regards to acne, when I think that there are potentially other things that we can explore as treatments. But, probiotics, is that something that you really advocate for your patients to incorporate when they're on antibiotic treatment?
Gosh, I love a probiotic for everybody.
Yeah, me too.
Honestly, just in general, acne treatment,
Antibiotic or not.
Yeah. So yeah, absolutely. I do recommend it just because antibiotics are so beneficial. They wipe out the bad bacteria, but they also do take some of the good bacteria too. So trying to replace that as much as we can.
Yeah.
I mean, we do what we do. So certain treatments are necessary to get the desired outcome, but anything we can do to try and avoid some of those side effects.
Yeah.
Yeah.
Skin health, GI health, it's just good for you, honestly. So regarding metabolic issues with women, so when we see these adult females that come in that have this cystic jawline type acne, and then you start the conversation with them, and then you realize, okay, we're looking at some other things too. We're looking at some increased hair growth on the chin. We're looking at, central obesity, irregular periods, difficulty getting pregnant. How do you approach that when you're suspecting some kind of metabolic imbalance?
So if it's a child, or I say child, if it's a younger adult, and I ask everybody of childbearing age, are you trying to conceive?
Yeah.
If they aren't, then that's where I think starting them on spironolactone and then sending a referral for GYN just to have both medical specialties prioritize their care. Yeah. So
even endocrinology maybe could be a piece of that puzzle.
Absolutely. Absolutely. But earlier when we were talking about spironolactone for that acne, it also helps with unwanted hair growth. So that can be really beneficial while we're working towards a solution. But having a collaborative care effect is a priority in those women.
I'm usually checking a lot of labs on these patients too. I like to, run thyroid panels and really, I don't dive too deep into it because then we start kind of getting a little bit into into endocrinology maybe. But, I do like to, really evaluate those patients carefully because while, they're just at the derm office with acne, there can certainly be a much bigger, piece to that puzzle for sure. So
it's all related.
Absolutely. Well, Autumn, do you have any final thoughts about acne?
Gosh. No. I love to treat it. I love to talk about it. I love to educate people, patients, family members on it.
As an acne sufferer myself,
right?
It's something. And I mean, even to this day, having had Accutane in the past and various treatments, still get acne from time to time. And it is just, it's frustrating. And it's so, irritating to even be, in a position to have all the answers at our, disposal
Yeah.
and be able to have all these treatments and still struggle
It
sometimes.
still affects us.
Yeah, it really does in a big way.
I took Accutane as an
Yeah.
adult. I think you did as well.
Yeah,
So it's not a teenage problem.
it's really not.
It's not. I think
Seems
that's one
like
of the biggest misconceptions.
I agree. Seems like a forever problem sometimes.
Well, there are solutions.
Yes, there are definitely solutions, things we can do to help. I think a big take-home message that I have for patients that may be listening and struggling with acne is, it's not something that you have to go to a pharmacy and go to a shelf and try to navigate by yourself.
Oh my gosh,
Acne
no.
is such a, like I said, it's a marathon.
It is.
And it's such a customized skincare routine
Right.
that goes by, the patient and by how they present
Right.
and their issues and the type of acne like we talked about. And it's something that we truly can be along for the journey for these
Yeah,
patients and
give
really
them that
help.
specialized care.
Absolutely.
Yeah.
Customized approach.
Yes.
That's everything.
Yeah, agree.
Well, thank you so much for being on today.
Yeah, thank you
I appreciate
for
it.
having me.
You can find Autumn at the DERM Center.
Yes.
She's a board certified dermatology nurse practitioner
Yeah.
and so happy to have you today.
Thank you.